Hi, in this video, I'm going to be talking with you all about how to read lab values. All right. So if you need help to better interpret how to read lab values for whatever reason, then you want to definitely stay tuned and watch this video all the way to the very end. All right. Okay. So I'm going to go ahead and share my screen right now. And we're going to go over lab values right now with you. And so what I hope that you'll get from this video is that you'll better understand what each of the labs are, what they mean, and then also how to read them, interpret them, and what you need, what is a critical lab value, right? What you should do or not do, etc. So this actually, and what you're looking at right now, this is actually taken from inside of my book called Lab Values That You Need to Know. So if you want to get the book, you can always check the description below, or yeah, it should be always tagged in the video, but check the description below. Or if you watch this on Facebook, comment book. But if you're watching this on YouTube, then just check the description to get the book, if you want to get the book. Okay, so let's talk about lab values. And then if you want to get some of our free stuff, some of the free things that we have, you can check the description to join our nursing list, or you can check the description on Facebook and comment the word free. Okay, so what are some lab values that you need to know? And just helping you to better understand that. So we're going to first talk about we're going to talk about CBC versus the chemistry panel. So the complete blood count, those are going to be like the labs are going to the blood specifically. So like, for example, WC, hemoglobin, hematocrit, versus chemistry panel, those are going to be the electrolytes. So like sodium, potassium, etc. So one of the things that's important for you to realize is there's about, I would say, 3 to 4 things you need to study and know, especially for your nursing exams, that you need to study, remember, and memorize. One, you need to remember, you need to actually know what the normal range is, right? So for example, WC count, as you can see on the screen, is 4 to 10, right? So you need to memorize the normal range, but you should also know what it means if if it's low, right? So what does it mean if for example the WC is less than 4, and what does it mean if the WC is higher than 10? And then last, you should also know what are the interventions that you would do if it's low versus the interventions you would do if it was high. Do you know those things? So you need to know all those elements. So not just the normal range and what it is, but what are the signs and symptoms when it's low? What are the signs and symptoms when it's high? And what do you do when it's low? And what do you do when it's high? Okay, so starting with the white blood cell count, what are WBCs? WBCs are essentially like, I want to use the word macrophages, but it's something that our body has to protect us against infection. So that's essentially what it does. So our body needs to create enough of them to protect us from infection. So if the WC count is less than 4, what does that mean? Then it means that they're going to be prone to infection, right? Because they don't have enough of them to kill the bacteria, to kill anything that comes in the body that's not supposed to be there, right? And there was this really cool video I saw actually recently. I don't have it on here, but it was this really cool video where I saw on social media of literally showing a micro view of a WC, a white blood cell moving through the cells. It was really interesting. So maybe next time, right? So that's essentially what it does. So usually if it's low, most times the only reason why it may be low and the patient's not producing enough is because they have cancer. So a lot of time they're on chemotherapy, which usually unfortunately like wipes out their WC cell count, right? So that's what essentially does. Like when they do the radiation and the chemo, it's killing, the cancer, but it's also unfortunately getting rid of the WCs as well. So their white blood cell count will be low. They're gonna be more risk for infection, and they're gonna usually be more pale. So what you're gonna have to usually do with these patients is put them on something called neutropenic precautions. And if they're on neutropenic precautions, then what does that mean? Then you need to put them on special isolation. It's also called reverse isolation, where um, we we make sure that when we go in the room, we always wash our hands. I mean, we should be doing this anyways, but it's more intensely. We don't put any fresh fruits or fresh plants, because all that stuff may have bacteria as well once you bring it and introduce it to the patient. We have to notify staff, including like the CNA or unlicensed assistant personnel with the UAP on the test. And so we have to also be aware of that too and let them know, so that way they are more protective with the patient. We need to usually wear like a mask as well going into the room. So these are all things that we're doing to protect the patient. Okay, and then also limit visitors, usually no visitors, ideally, until their WC count goes up. But if, let's say, the WC count is elevated, right? So it's greater than 10, what does that mean? If it's above 10, then that means they probably have an infection right now. All right. So what's happening is that the body is producing more white blood cells to try to attack an active infection in the body. So what you're going to usually see when they are having that high white blood cell count, the patient will usually have a fever. They may also be tachycardic. They're going to have like runny nose, all the type of cold-like symptoms. They could also be dehydrated too. And so typically, right, so those are the signs and symptoms. Typically what we do in that situation is that we give them antibiotics. So they need to be on antibiotics and usually also fluids, unless they have like heart failure or kidney failure. Then we usually don't want to give them that much fluids. Okay, so that's usually what we'll do when it's really, really high, right? When it's above 10. And that's what it means, right? So you see example what I just went over right now? That's an example of what you need to know for one lab value, right? The way I just went over right now, I went over what the normal range is. What does it mean? What does it mean if it's low? What does it mean if it's high? What are the signs and symptoms, right, for both? And what are the interventions for low versus high? That would be an example. So then now let's try, let's do the chemistry. All right, so let me go down here. Okay, so going to the chemistry panel, right? So let's talk about sodium, right? So sodium, the normal range that you need to know, right? 135 to 145, that's the normal range. So what's sodium? Sodium is a very important electrolyte in the body, right? So it's a important electrolyte in the body, and not to really go too much into microbiology, but just know it's essential electrolyte in the body. Okay, and so if their sodium levels are low, right? So they're, for whatever reason, they don't have enough sodium, then they're going to be confused. So usually they're going to show signs of confusion. And then also they may, if it gets too low, so like below 125, even sometimes I've seen like 119, they're going to have seizures. All right. So this is why we have to respond immediately. So if you have a patient and their sodium is like 130 or 128, you can't be like, oh yeah, it's low, and do nothing. We have to actually like do something immediately, because otherwise they can have these symptoms, the confusion, the seizures, And then seizures can affect the neural activity of the patient over time. So these are the reasons why we have to treat it right away. And sometimes these levels with sodium, um, they can be abnormal because they're having diabetes insipidus. There's an issue where they're either there's too much fluid. Sometimes for some patients too, they could be having hypernatremia or hyponatremia. There's too much fluid in the body and it's diluting the amount of sodium, so it's making it appear that the sodium levels are low, but either way, it still can put those symptoms at risk. So if they have low sodium, then usually we're just gonna it's a very simple response, honestly. We just give them either salt tablets or we give them fluids, sodium chloride, normal saline through their IV, right? And then we recheck their sodium levels. Okay, so that's essentially what we'll do. If their sodium level is high, right? So it's above 145, then usually that could be associated with higher blood pressure. So that could be, at the same time they can have elevated blood pressure, weight gain, and then also it can also their sodium levels can also affect their skin turgor as well. And it can have some pretty serious consequences when they also complain of feeling really thirsty though, as well. So we have to treat it and respond immediately. So usually if the sodium is very high, we have to identify what is the underlying cause. So with the low sodium is easier, because we just give them fluids and sodium tablets. And sometimes they have low sodium because of like they're alcoholic. They drink a lot, or they just don't really they're not getting enough from their diet, which is usually rare. So elevated blood pressure. So depending on how high it is, we have to identify what's the root cause and treat the root cause. Usually, and from there, the sodium levels will go down. There's not really um, and then it just kind of depends on like what's causing them to have high sodium levels, right? So usually we're treating the underlying cause. Okay, so that's essentially sodium. Of course, you need to be familiar with the other levels on here, like potassium, chloride, calcium, glucose, etc., BUA, and creatinine, and then the other CBC levels that I didn't have time to go over today. All right. So these are some of the things that you need to know. I hope that you found this helpful. Please let me know in the comments what you took away, what you learned. If you did find that helpful, make sure you hit the like, subscribe button below. If you or have not already found out, we're having a 6-week review class. And so this is going to be a great opportunity for you to learn what you need to know to pass your NCLEX exam. So in the 6-week review class, that's where we're going to help you go over content. So we'll do more content review. We'll meet every single week virtually through the Zoom. And then also we'll do practice questions as well. We'll do next generation questions. We'll have weekly homework assignments. One of the biggest goals with this program that separates it from the rest is not just giving you information, but helping you to comprehend it, helping you to better understand it really well, so that way you know how to apply it to the test. So you'll walk away with strategies, you'll know more information, you'll understand why you're not passing the exam if you have indeed failed it before. So you'll understand why, you'll know what to do differently, even if you've been out of school for a few years, 5 years, 10 years. We've had a lot of success with students that have taken the test multiple times and then finally passed with our program. So if this sounds like something that you may be interested in, then make sure that you go ahead and check the description below this video for more information. It's going to be a great opportunity. It's not always available all the time, so you definitely want to get started and get access to it right away so you can be a part of the class. All right. So once again, and if you have any questions, feel free to comment below this video too. So once again, thank you for watching. Like, subscribe, and share, and I'll see you the next time.